You do not need to be a hum bio major to take this course. You don't even need to imagine a future in medicine. Of course, it's wonderful if you do, that's great, but if you don't, that's fine as well. I have worked in healthcare as a registered nurse for 10 years in different hospitals, and I have studied medicine on 3 different continents. And I truly believe that the best way to critically examine the way we do things in this country is through comparative analysis. The way that we conceive of medicine and illness and healing is interesting in comparison that way, but it's also really a great tool to look at how things have changed here through time. We do a lot of visual analysis as an example of how those sorts of visual languages are also really important in critical analysis. I would point to the stethoscope. So if you look at a picture, how do you know someone is a doctor? They're wearing the stethoscope. If you go back 150 years, that was not the case. So the focus on visual rhetoric really helps sort of unpack the images that we see around us all the time. And we look not just at what they mean, but how they come to mean. It gives you a great way to do critical analysis for your life. A student was interested in art history and ended up doing a project on representations of illness and healing in Renaissance artwork. If you're interested in, for example, CS, you might do something around artificial intelligence and the future of healthcare, or look at the various different software programs that we use in hospitals along with the electronic medical record. If you're interested in genetics, you could do something around genetically modified food or pre-implantation genetic diagnosis. So if you or someone you love has ever been sick, you are completely qualified to take this class.